As you can see here, this is a case of this is a I am presenting here. I am implanting here a toric IPCL. You could see the marks which I placed on the slit lamp. I never use ink. Instead I just scratch in 0-180 degree with help of needle, so they may remain for longer time. Here I am making 2 side ports, as you can see in this video. Am I audible to all?
Yes, sir. Please go ahead.
Yeah. So now what I do differently, that I am not using viscoelastic here. I am not putting visco in very initial stage here. So as you can see, because putting visco for a longer time will make it more sticky to the surface and less likely to be evacuated while irrigation and aspiration. So I avoid using visco here. Here I put some visco as well as fluid. Then I am loading my IOL here. As you can see, the vault is up, and you should keep the holes at the optic edges superiorly. So you should face it towards yourself. If you are implanting it in the right eye, suppose like here I am implanting it in the right eye, so I put these holes towards me. And you can place like this and check for mobility of the IOL like this. Okay, and then you lock. So before lock, you should check the mobility. After locking, you should check again. And now I am removing these airs because they may obstruct your view while implanting. So now lens is well movable too. It is there. So now I am putting very small amount of the visco here, and wash out these blood trickled from the wound. So sometimes this blood clot may enter along with your injector. So remove the residual air and then implant. And again, you should look for the proper orientation. As you can see here, these are the projections which will guide you, as well as these holes on the optic edge will also guide you that your lens is placed in correct orientation. So as you can see, these holes should be superiorly placed. Now, and these projection marks will guide you that your lens is in correct orientation. Now, I'm tucking the haptics behind the iris. It is slightly difficult because the haptics are almost hollow. They bear big holes because this lens act as a buffer for some changes in some differences in the white to white diameter. So that's why the haptics are almost hollow, and and the lens injury is also likely to happen because of them. So here you can see the excess mark is there. Now I am hydrating the most of the visco by just irrigating it. So irrigating well as well as pushing the eye. Now I try to hydrostitch all the wound. This will make more secure AC formation during irrigation and aspiration. So usually I hydrate main port before using irrigation and aspiration. It avoids prolapse of the iris while irrigation aspiration also. Now I am irrigating and aspirating all the viscoelastics. You can put your aspiration port near the central hole so that it aspirating. As you can see here, this air bubble is moving, whole viscoelastic is moving. You can see clearly, it is visible here. So continuous irrigation and aspiration, it is very necessary because it is usually seen that some residual viscoelastic may be left behind the IOL. So another thing I do differently, that I always go behind the lens. Many people most of the people do not perform this, but I am very comfortable with this maneuver. I go behind the lens by keeping the support of the aspiration cannula from the front. So that lens does not hit the cornea. So I actually sandwich the lens between the irrigation and aspiration cannulas. So this will give me ultimate visco cleaning, and I am very comfortable. This maneuver works well with my hands. I always perform on both sides. Like you can see here also. I change my hand now. I'm grasp my irrigation port in my left hand and going beneath the lens again. Okay, so you can see here. This is very safe with my hands. I have no problem with this, and this will give me ultimate cleanup of the viscoelastic because we are using HPMC here, the dispersive viscoelastic, so it should be washed thoroughly. Now I'm irrigating ports while my irrigation port inside. So this will give me stable anterior chamber. So, and you can check the final alignment of the axis along with your marks. Okay, so this is absolutely fine. All marks are in a single line. Okay, so I hydrate and then check. I also use intracameral moxie also at the end. So this is the end of my video. Thank you so much for watching.